We're here to realign your mind. Take 5, you're not alone. CJ and Jester bring you home. It's okay to not be okay. Let's talk it out, don't drift away. Mental health, it matters most, so come in close and raise a toast. To the ones who fight each day, to the silent words they never say. You're strong, you're seen, you're truly heard. We got your back, you've got our word. Oh, take 5.
Oh, yes.
CJ and Jester. Talking true.
Let me take the time off to say a very special good morning to Grenada, Carriacou, and Peter Matnick, the rest of the Eastern Caribbean states, the world over.
Just for you, take a breath.
It's Take 5 in effect for today, Tuesday, being the 25th of August, 2026.
Take 5, you're not alone. CJ and Jester bring you home.
Of course, I'm your host, Jester Noel. Pretty soon, I'll be teaming up with CJ.
Wake up, it's a brand new day. Got some things I need to say. Feeling heavy.
We have another
Come take 5, your
interesting topic of discussion
how much they care. 2 good friends always there. Let the sun
on the Mental Health Show
peace and
of Take 5 this morning.
oh, take 5.
And of course, we'll be having a guest as well.
Talking truth and lifting pressure. Every Tuesday, 10 to
The topic of discussion this morning:
in space, just for you.
how can you mental
Take a breath.
health care with little resources?
We're here to realign your mind. Take 5, you're not alone. CJ and Jester bring you home. It's okay to not be okay. Let's talk it out, don't drift away. Mental health, it matters.
It's a good-looking Tuesday morning. The sun is out,
Fight each day.
shining in all its brilliance.
Say, you're strong, you're seen, you're truly heard. We got your back, you've got our word. Oh, take 5.
So just waiting to make that link with Kenro, so that she can lead us in a word of prayer.
Every Tuesday, 10 to noon, we're holding space just for you. Take a breath, take your time. We're here to realign your mind. Take 5, you're not alone. CJ and Jester bring you home. We laugh, we cry, we share the ride. No judgment here, just love and light. You've got a place right here to stay. So take 5 and heal today. Take 5 with CJ and Jester. Talking truth and lifting pressure. Every Tuesday, 10 to noon, we're holding space just for you. Take a breath, take your time. We're here to realign your mind. Take 5, you're not alone. CJ and Jester bring you home.
At Sugar's Repair Services, we offer digitally calibrated machines, resurfacing engine heads, general machinery. Show us your pattern and we'll make it with precision machines. At Sugar's Repair Services, we satisfy your needs. Just ask and it will be done. Call us at 473-418-1845. Sugar's Repair Services.
Where is Kenro this morning? And I'm pretty sure that the telephone line is intact. Let me just give you a couple of ticks on the clock. If not, I'll do what is a customary. Let me just put it down here. Heavenly Father, we thank you once again for rising us up this morning as you continue to allow us to breathe in that fresh air. We are surviving, God. Many others have challenges, oh Father in heaven, God. And we ask you to touch them in that marked and special way, that discomfort of who are going through health problem at this moment, and there are a number of people that I have in mind. I ask you know them, Father. You know them by name and number, Father. I ask you to touch them in that very marked and special way, so that you can address their needs, oh God, and when it comes to health care. For we know you are the greatest healer, you are the greatest doctor, the greatest physician, Father in heaven. Through your powers, you walk in mysterious way, God, and you give man the dominion over all things. Father in heaven, God, we thank you for just so much. We glorify you. We maximize your name. We amplify your name, Father God in heaven. We thank you for just so much. And Father God, as we are about to embark upon this program this morning, we invite your blessings, Father God, so that things can go well for the general upliftment of our nation. We ask this through your Son, Jesus Christ. Amen and amen. Oh, yes, so there we had it, reaching out to the Almighty God, asking Him to throw His blessings on this morning's program.
Android app. Looking for a professional website, graphic design, or Android app? Affordable price? HTS Family.
So I'm about to make that link with my co-host.
It's a brand new day. Got some things I need to say. Feeling
as I'm about to go over.
Come take 5, you're in the zone. Voices
and say good morning to
two good friends always there. Let the sun
the petite lady.
Peace and hope is sure to find. I'll take
good morning to you, Claire.
Good morning. How are you?
I'm good, and you?
I am good. I'm good. Can't complain.
Well, again, we are making that link for yet another week. It is the 25th of August, 2026. Claire.
Mm-hmm. It is. It's coming right down to the wire, isn't it?
Already we can start saying so.
Not too long ago, we were just August 1st. And next week will be, let me see, Tuesday. On Tuesday next will be September 1st.
Yeah.
And you know, when September hits, it's like speed and accuracy down the line, eh? No stopping until December. And then you ask, where did the year go?
Oh, yes. It seems like, just last week we was greeting each other. Happy New Year, Happy New
Year. Tell me about it. Not to tell you how time flies.
Oh, yes. Oh, yes.
Just give me 1 second and I'll be right with you.
Yeah, do you think?
I have to just fix something here.
Yeah, do you think, man?
Take 5, you're not alone. CJ and Jester bring you home. We laugh, we cry, we share the ride. No judgment here, just love and light. You've got a place right here to stay. So take 5 and heal today.
Again, the topic of discussion for this morning at the Mental Health Show, your favorite mental health show on Take 5 with CJ and Jester.
Every Tuesday, 10 to noon, we're holding space. Just
how can you mental health care with little resources?
We're here
again. How How can you maintain health care with little resources?
I am back, Jester.
Oh, yes. So Clay is back. Welcome back, Clay.
Thank you, thank you.
That really wasn't long.
No. If you know what it was, somebody asked me to bake a carrot cake for them, and I had it in the oven, and I just switched. Like I forgot it was going to get burned, so I just had to go remove it from the oven.
Oh my gosh, then that you would have had to make a next one for the
I
person.
know, and I have to deliver it at 2 this afternoon, so
Look at that.
Yeah. So let me say good morning. And first, let me say good morning to Duchess. Duchess has made it on the live this morning, Jester. And if you do not know who Duchess is, that is Miss Marilyn Ferguson. I guess all the bad motor give her last week. No, she joined us this morning. Thank you so much. Buongiorno, Olavaci. Hope all is well with you. Thank you so much for checking in. Let me say good morning to Jessel Grant. Faithlin Holly Douglas, Daphne Dayton family out there in Toronto. SBW, good morning. Pat Pear and family, William Pear. Arlene Tate, good morning to you. Wendy, good morning. Chance the Gamer 9722, right here in Toronto. Good morning to you. I hope you had a great time with your bro while he was here. Good morning to Junior on the Grand Etang Heights. Hope all is well with you. The Hill Street people. Nicholas Snag. I spoke to him a couple days just because I think he went on hiatus with us, but he's rather busy these days, but he's going to check in when he can.
Okay.
Inspector Panchi, good morning. Good morning to the Real FM crew or the gang there. Kira, Nabi, Dugo is still on vacation, but he's my son. I could say anything I want anytime. Chester Bandy David, good morning to you. Good morning to Olovaci, as I said, buongiorno. NP, Nikki Hills, good morning. I hope that you're feeling much better this morning. Shadi Belfon, Carol Belfon, Nikki Sylvester, good morning to the Elite Warriors. And you see, Nikki is going back to school the 31st of August.
You'll touch on that.
They're going back to school in August. What's wrong with you? Good morning to the university under there.
Cashew tree.
Yes, Natalina Buddy, good morning to you. Good morning to Jenny Mason, Lorna Bain. It's right here in Spice, no, right there in Spice Country. Just so you have the thing to say good morning to her. Good morning to Hilarion Gonpot. Good morning. Thank you so much for checking in. Good morning to Jawanda. Leslie Nicholas, good morning. Cabrino Philip, good morning to you. Aito, Ted, Bushies, Justin Tutman, good morning to you. Good morning to you, wherever you are and listening. Good morning to you. Hope that you can check in with us and make your contributions to the program that we have this morning. Jester, over to you.
Yes, well, let me say a special good morning to Wayne Ted John, Alistair Aito Dubois. His mom will be laid to rest tomorrow, God's will.
Tomorrow it is, okay.
The funeral service will be at the St. Patrick's RC Church. Yeah.
Center yourself. Go ahead.
Yeah. All right. Andy Moose Bartholomew, Mrs. Glenn and family out there in Boston. Good morning to you. Who's next? Who's next? Coming back.
Kathy London, Mrs. Bisesa, Godchild.
Look at that. You're a good girl.
Justin Tutman and family.
You're a good girl. Let me see if I could center this camera.
You're good now. You're good.
Yeah. Claire in Maho, good morning. Celia Robinson and
Is Robinson? Is it Robinson or Robinson?
Robinson. Yeah, that's what I'm saying.
Pronounce people's name properly.
Let me take my time and pronounce the people's name properly. Celia Robinson. And
yes.
Good morning. You understand? Michelle. That's Godchild in Eversally. Good morning to you. Miss Gladys O'Dane Maddis, good morning. Yeah. Spice Ram, glad you mentioned Spice Ram.
I don't not mention it because I know you have to call me and eat me up. I'm waiting for him to call me. But let me say good morning to We Know It's FM 97.9 right there in the Big Apple on the other side of the pond. So let's say good morning to him. He's on the side of my pond, I think.
Yeah, G1, big up your status, bro. Yeah. You know?
Yeah.
Who else?
I think that's it. You don't know a lot of people, so just take it easy.
Yeah. But a lot of people know me. That's the thing.
You have to know the people that know you. That's the whole thing about it.
Me
Oh,
not
Nicholas
know.
Snack has checked in. It has been a while since I took the time to check in and wishing to take 5 community an amazing day filled with kindness. Thank you so very much, my brother, my good friend,
Thank you
my
so
mentor, my
much.
everything. Yeah.
Special good morning to Lorna. She's right here on Spice Island.
Mm-hmm.
Yeah. Haven't come across her as yet.
You may not get a chance if you don't go soon. She'll be flying the jumbo soon again.
Yeah. Actually, that's the last week.
Yeah, that's it.
Yes, girl.
So,
So,
mm-hmm.
okay, you started by talking about going back to school on the 31st of
I said
August,
going back to school in August.
which is absolutely ridiculous to me.
Why would you say such a thing? August is a month.
You know, and I was speaking to a teacher only yesterday. So I asked her, I say, is it for really, has it really been confirmed that school will be reopened on Monday, August 31st? And she said, yes. I said, well, sorry, my child would not be returning to school on August 31st.
But
That's not.
you're thinking backward, Jester.
Oh, you could say what you want. Let me think back.
Because schools here and in the US and a lot of other countries are going back to school. They went back to school like the second week of August.
You rightly said the schools were? Schools were?
Here,
Okay. Right. Well,
and there, and everywhere,
where you are there is
and
not
everywhere.
here. So you have to
But Sparrow saying, mommy, I want to go back to school, and you go back to school in August. The child wanted to go back to school in August, so he just come to fruition now. They went back to school, went back to school in August.
No, on a
So let me
serious
ask you something. What's the difference one day make in going back to school the 1st of September or the 31st of August? You tell me.
Well, that is what I don't understand. So why is it that one day, right? They choose to reopen the school another day and they couldn't start from the first. What is it? That's how I'm looking at it.
It's just a normal day. Monday, the 31st of August. It's a Monday. School starts on a
Well,
Monday, not on Tuesday.
Listen, you lived here quite a lot of your lifetime. Or you have gained your primary school and secondary school education. Do you ever know in your time of schooling in Grenada that you had to return to school in August?
Well, that was then. This is now.
No. You not answered my question.
Oh well, no.
You will
Okay. No. But that was then, and this is now. When you had your primary, secondary, and all that school going on in Grenada, as we know, did you have cell phone? Did you have TVs? Did you have running water? Did you have internet? Did you have electricity in every home? That was then. This is now. One day in August doesn't make your child recede from what he's learning or from his education. One day doesn't do that. And it's about time that we get with the program about thinking about what used to be then. And if we stick in what was then the things that was good, what was then, we're not even practicing it today. Like good manners, good everything that we were practicing before, they're not practicing today. And everybody accepted that this is what young people does. So one day doesn't make a difference. If you go to school on August 31st, if I send my child to school in Easter Monday or Easter Tuesday, she going to school, they're going to school because it's the education account, not the day that they go back.
This is clear speaking as well. This is just another speaking. So fundamentally two different type of individuals.
Of course, we are never the same.
Of course. But I'm saying.
So let me ask you something.
From over the decades. All right. And as long as I know myself, and I didn't tongue, according to Mr. Pierre, I ain't tongue long.
Yeah, that's not your first rodeo, so let's go.
You understand what I'm saying?
Good morning, Mr. Pierre.
There are times there will be like, depending on how the year falls, I think like a leap year as compared to the
other February 24th, 2029, every 4 years.
So sometimes you have a 9-week period of vacation.
Right.
And some years you will have an 8-week period of vacation. That's how I've always known it to be.
Right.
I've never known that school reopens in August. So as a matter of fact, right? people used to actually see when you do silly things.
They call you August Fool or something like that?
Yeah,
Not April? Not
what?
April Fool anymore?
No.
Are you born in August?
They might say that for the 1st of April too, right? But more in August.
Or you go to school in August.
Well, you understand what I'm saying?
So let me ask you a question.
Yeah.
If, let's say, on the 31st of August, children that are in, what form your son is in?
My son is Form 1.
Okay. All Form 1s on the island of Grenada will be getting scholarships from then until they reach their university level to get their university degree. And so, would you keep your child at home on the 31st of August? No. Just answer yes or no. Yes or no. Just answer that for me, and we're done. Would you keep him at home if they promised? They said that all Form 1s around all secondary schools on the Spice Island will be granted scholarships until they're 18 years or 20 years to the preschool, formal or tuition, how do you call it, tertiary education. Would you keep your child home on the 31st of August?
Clay, you just bring some kind of reasoning there.
No. Answer the question, yes or no. It's simple.
Something like that. That is an opportunity people who may not want to miss that. I mean, that
then
is just
31st of August, don't send your child to school. Do not send your child to school.
Oh, please, you're just trying to be ridiculous. That is
I am not.
People will see that in you for because that don't make it
Okay, so here's a point from Mr. Pierre. One day makes a big difference. Why do you believe people are objecting? Traditions are important. Customs of our people expectation. Saying have impact. That's straight arrogance. Okay, so that's Mr. Pierre saying one day makes a difference because tradition, right? And the custom. But then again, a lot of traditions that we are following doesn't make any sense. Some of them has no truth in it, and it's tradition, and we are going to die by tradition. Tradition says that when somebody died, they have to be buried. I want to be cremated. That's not a custom for us. Every one of us has to be in the tradition and the customs. They want to be buried 6 feet deep, right? I broke tradition, and I say when I die, cremate the daylight out of me. Well, the dead out of me then, because I'm no longer there. That's not a tradition that we follow. That we follow in the Caribbean and so. But now it has changed that people have choices whether they want to be buried or whether they want to be cremated or something of that sort. Or if they want to be embalmed in this kind of way. We have choices, and the traditions, we break traditions. There are a lot of things that we do just that we call traditions and customs, and it doesn't make any sense in the long run. And I'm not saying that is my take on the 31st of August. That is my take. People don't have to feel what I say, but that's my take. Because if I tell you my children are at school age level right now, I wouldn't keep them home one day and say, I ain't going to send my children back to school in August because you do. Because what you're doing, Jester, or what you're saying is that you tell yourself that your child is a fool or a stupidity if you send him back to school in August, because that is what the tradition and that's what the custom says. Pick me up on that.
That might be part of it. But
yes.
Claire, let me tell you something.
I'm listening.
If at all I did not believe the mantra of when you're in Rome, you do like the Romans do, you confirm that for me today. Let's move on.
We have our guest. Anytime you see a catch you where you don't want to be, you tell me, let's move on. Center yourself. You're good right there. You're good there. Stay there. You're good.
So,
but let's before we continue, let's ask Mr. Philip what is his take on it. He might give me a different answer to what you have to. So let's.
Claire, I thought you would have introduced the man in a nice way.
Sorry, I said Mr. Philip.
That's what you're supposed to do.
Well, you see, the school thing have me. Let me say good morning to Mr. Stan Philip. He's going to be talking to us this morning. He's a guru on healthcare and health insurance and stuff like that. So we're going to be talking to him. Good morning to you, Stan, and how are you?
Good morning, Claire. Good morning, Jester. I'm fine. And how are you?
Good morning to you, sir.
Well, you see, I'm good because we're going back to school in August.
Yeah, but interestingly, while you're speaking, I was smiling because When I was at university, we began school in August. Um, that's when we went to school. So in the past, people put August boys, school boys, as persons who
Stupid.
position stupid.
Mm-hmm.
But you see, in this modern day where classes can be done at any time, that was just tradition because we still follow that in August children are on vacation.
Mm-hmm.
But SU has classes still in August. Other universities have classes in August. So that is just the things that were practiced in the past. Traditions are being outpaced by modern advances. And that's a reality. Yeah.
Okay, so here's a comment again. Mr. Pierre says, look at the amount of time and energy we are spending on that subject matter without any justification or explanation from the authorities that be. He has a point because if, as he says, everybody's going back to school August 31st, there should be a press conference or something to say that this is the reason why we are thinking about sending back our children to school that day because it's the first day of the month of August, right? The last day of August, the Monday. And normally children go to school on Monday or Tuesday or whenever it is, I don't know. But he has a point when he says the powers that be should give us some sort of explanation as to why they came to that decision to send children back to school on August 31st. Anybody
Well,
with me there?
I think the curriculum and the programs for the different uh, we call it semesters
Mm-hmm.
run for a number of weeks, right? And
Mm-hmm.
in order to catch for example, the next break could be Christmas.
Mm-hmm.
In order to catch that break, you have to start at a particular point, and August 31st is. I mean, to be honest with you, if I did not hear you talk about it today,
Mm-hmm.
it would have never crossed my mind about going back to school in August because I heard school was opening on the 31st of August, and I said, okay, that's the beginning of the term, and that's what it was for me. Nothing about the tradition of school should be in September. But like I said, if the curriculum is checked and the program, that date would take us to the next break. So the number of weeks that's needed for the curriculum to run they had to begin on the 31st. If they started 1 week later, we probably would not have had a Christmas break in Christmas. So I
Okay,
think that's
that
that's
makes sense.
yeah.
Makes sense to me because they do have different curriculums and different terms and stuff like that. I got Jester, you got it. Jester, Jester, you
Okay.
got that.
I don't want to prolong this
No, we're
whole
not prolonging. We just the explanation is
because
good to me.
no, but what I'm saying, yeah, times sometimes things that you're not prepared for, and as a result, yeah, times sometimes things end up in a school, and sometimes the school have to shut down for a week,
Yeah.
and they still come back and find time and catch up with the syllabus. So
Well, yeah, but we're saying that even though they closed school they didn't start on, let's say they started on September 2nd, September 1st, which is the Tuesday. Would that make such a big difference from the 31st though? To
no,
catch up one
it,
day?
it wouldn't.
Okay,
It
then
would
let's leave it at that.
definitely.
Good morning to Kira. Hope all is well. Thank you so much for checking in. So this morning we're going to be talking about how can you maintain healthcare with limited resources. I said little, but what little is little, but it's limited resources. So we have Mr. Stan Phillip, as I said, who is a guru on these things that we're going to talk about this morning. Somebody sent a message to you, Mr. Philip. It says, well done, sir, by explaining the syllabus, the 1 day missing, the 1 week missing, and everything. Good morning to you, Carol Belfon. Thank you so much for checking in. So let me just read the first paragraph here for you, and then we'll take it from there.
Okay, before you move on,
Yes.
as you make mention of, it should have been limited or literate. Within the context, does it make a difference there, Stan?
Yes, limited and little. You call me
Yeah.
little, but I'm not limited.
Yeah, it makes a difference. Little suggests that your resources are minimal. Limited suggests that you are constraining yourself, right? There is the possibility of more could be done, but you are committing a certain amount. That's why when there's a limited liability company, what they're saying is that you're a company, but there's so much you can do and no more, right? So that's what I said. The little means I don't have. Limited means I'm restricted in what I can do based on what I'm doing. That's where I
And that's a good take. And don't bother with Jester. Let's go.
no,
But
no,
I just ask a question just for
yeah.
clarification.
No, you don't want. You just
For
want
our
to.
listeners and viewers out there.
Yeah, right. Tell that to the fool that go back to school in August.
Oh my gosh. Why you like that, girl?
Uh, yeah.
So it says here, the unhealthier you are, the more you pay for healthcare. That's a fact. The Affordable Care Act, which is ACA, guarantees anyone who wants a health insurance policy at a reasonable price, but health insurance companies can charge higher premiums if you smoke. They can no longer rate you based on physical exams, but you'll still pay more in healthcare costs if you are unhealthy because you need to see doctors and specialists more often. You'll be responsible for co-pays and co-insurance for these visits and for any medications that are prescribed to you. You may also need a more expensive high-tier plan if you see doctors frequently, which is the only way to offset the heavy cost of frequent visits and high deductible. By incorporating lifestyle changes, you can reduce your risk of developing chronic health conditions and lower your overall health costs. There are also a few other ways you can trim your healthcare costs, and it says here is more, but we're going to just stick with that. And Stan,
Yeah,
you
I
want
like
to know?
the latter
Mm-hmm.
should have been first.
Yes.
You see, because preventative care, a prevention is always better than cure,
Mm-hmm.
right? And many of us spend our time earning resources at the expense of our health. Then we spend the resources to get our health back, right?
Mm-hmm.
So we flip the coin. So if we have to have a healthy nation, we need to begin with educating the nation to live healthy lifestyles, right?
Mm-hmm.
The healthier your lifestyle is, the least likely you are to need health interventions. I'm not saying it's not going to happen. You see, because we talk a lot about these sustainable development goals. And goal number 3 basically states that we should ensure healthy lives and promote well-being. So before we get to being unwell, we should spend our time and our resources speaking about um, adapting or modifying our lifestyle. Um, I had a recent experience, Clay, where I mean, I never bothered much about what I ate.
Mm-hmm.
I just eat.
Mm-hmm.
And one day my wife said to me, "Why are you walking and dragging your feet?" I said, "No, maybe it's a slipper that I'm wearing." I was getting the signs, but I was neglecting it. When I went to see the doctor, he had these pressure machines, not sugar machine.
Mm-hmm.
And he said, "Stan, look at this." So, I mean, I kind of alarming way. And I said, "What, doc?" He said, "I am getting an error reading on this machine. And whenever there's an error reading on this machine, it means that your level is extremely high." I don't want to tell you the number it was. But the point I want to make is that if we pay attention to our body, it speaks to us.
Mm-hmm.
It gives us a headache. Is not just a headache, you know.
No.
A headache is an indication that something is not the way it should be. And men especially push the can or kick the can down the road. We don't pay much attention to our health. And because we don't, we build up a case where by the time we do, maybe you'd have had to spend $10. Now we have to spend $100 because our health has deteriorated so much that we have
Mm-hmm.
to You have to spend monies to reverse it. So that's why I said the statement you read should the first part should be encouraging us to live healthy lifestyles, right? Unfortunately, many of us don't. So we are the situation where the average person needs to get themselves checked, right? There should be a routine. Interestingly, the dentist calls you every 6 months to do your cleaning.
Yes, yes.
How come your GP don't call you to come and do your medical checkup?
Okay, can I stop you there? My MD, when I go to see him, he sends me for blood tests, he sends me for whatever, whatever. He gives me an appointment to come back, whether it is in 3 weeks or 3 months. We are the ones that do not follow up on the requisition that they give to us.
You
I
see,
won't blame them.
the system you're under, Claire,
Oh,
is
okay,
one
sorry.
where there is an established protocol for health, right?
Okay, right.
There is a regime that pays to take care of their clients. In
Okay.
our parts, we don't have that, right? Um, Canada has one of the better organized healthcare programs, right? Um, there are Grenadians who still time their visits back to Canada to coincide with the health checks, right?
Yes, yes.
I'm not faulting them for that. But with an organized system, that's okay. But in a disorganized system, which is true to most developing countries, where people have to make a decision. I'm not feeling well today. I'm down to my last $100. What do I do? Do I go see the doctor or should I send my children to school? And you take a decision because of your limited financial resources to send your children to school. So you are postponing getting checked. And the longer you do that, is the more likely by the time you get checked, your condition will be so advanced, right? That it may cause an arm and a leg. You know, I say that, I say it with regret. There are scores of Canadians who are just waiting to die. They know that they will die because the intervention they need, they cannot afford it. So they have no option but to wait to die, which is very unfortunate. In our modern society, interventions that can prolong people's life or make people more comfortable in their living should not be at the stage where people have to decide to choose between getting healthy or remaining healthy and meeting their daily financial needs. So that's us in Grenada. A friend of mine came to my office the other day and I was saying to him, you can go into any insurance company in Grenada and buy a motor insurance policy. You can buy a whole life insurance policy, but you cannot buy an individual health insurance policy.
Why is that?
They will tell you they only write in what they call group health insurance. You have to be part of a group, right? Now again, insurance is about probabilities. So in their mind, if there's a group of 25, there's a premium charge for the 25 people, so they can spread the risk. If an individual walks in, until and unless you have a number of individuals that you can create a pool for, that's a high risk. The interesting thing though, what comes first, right? The chicken or the egg? Because if you do sufficient individuals, you'll have the pool. But they're not doing the individuals because they don't have the pool. I know that's a chicken and egg situation. So I was telling that friend that individual individual health insurance could be a very lucrative business in Grenada. But because insurance companies generally, based on the theory that a single risk would not support itself, they don't write it. Right? So, like I said, you could buy it if you're part of Hubbards, Huggins, Brighton Miners. Yeah, you get it. But you are a proprietor, individual, or you work with a company. This is a particular company I remember when I was involved in life insurance and I went to them. Are you interested in buying a group insurance for your employees? No, sir, we're not spending that money. That was the position. No, as far as I'm concerned, an employer who sees his bottom line as being more important than the care of his workers is not a good employer because he's failing to acknowledge that the condition of his workers would affect the performance on the job, right? So there should not be this trade where, in his mind, if I accept it, then if the premium is 150, the union will ask me to pay $75.
Right.
So what's wrong with that? The employee is paying 75, so why can't you pay 75? So I'm just showing you that our current situation, particularly in Grenada, is one where the average Grenadian is disadvantaged, right? For the few who have coverage under their private health insurance, it is very limited. Almost every renewal,
Cost more.
benefits get dropped off, right? They are now, most of them are now doing catastrophic care, meaning that we only pay if you are at that level of sickness.
You're on death's door.
Some of them, they reluctant to pay for doctor's visits. And we back down to the whole thing of prevention. If an employee could go see a doctor every year or every 9 months to ensure that he's okay, that works to the advantage of the employer and the employee. So why not leave doctor's visits? Why are you dropping off medication except it reaches a certain amount? So the environment we're in is very unfriendly to the average Grenadian. I must say that Grenada has the best primary healthcare system in the Caribbean.
With all that you're saying.
The best primary healthcare system in the Caribbean.
Okay.
We have a proliferation of medical centers. You see, when those centers were built, the thought was clients should not be traveling over 2.5 miles or 3 miles to get medical care. So if you measure the distance between these clinics, you'll see that it's just about the maximum 3 miles away.
Right.
So those clinics were built to fulfill this. The problem is, so you have a primary healthcare infrastructure, then you have doctors visiting at particular times to do the cursory checks, right? I have a problem with that in the sense that a doctor is supposed to come in at 9, he gets in there at 10, so you miss an hour. So he's supposed to be from 9 to 12, he comes at 10, and he packs up at 12 to leave. But what does he come to that center with? His stethoscope, right? And his prescription pad. I have nothing against medical people, but I mean, I'm generally very frank when it comes to healthcare. He walks into his office, maybe he takes your name, and he puts his prescription pad at his arm's reach. Many people go to doctors can testify of that.
Oh, yeah.
He then reaches for his blood pressure machine, wraps it around your hand, pumps it up, takes your pressure, right? Takes his stethoscope, listens, then writes. That's what I see when I go to the average.
That's true. That's a basic, yeah.
Right. Now, he writes a prescription and you go to buy your medication and you have seen the doctor. What is missing, in my opinion, is the full triage, right? Because some of them do not take your blood sugar. I'm telling you what I know. They don't.
No, they don't.
They will ask you, Do you have any history of blood sugar in your
Diabetes,
family, diabetes?
cancer, whatever.
Depending on your
Yeah.
answer, they'll take it. Or
Mhm.
if the symptoms you describe to them suggest that you may be um, suffering, then they'll take it further, right? Um, so although we have the infrastructure for primary care, that's what I'm talking about. The interventions that's made, to me, it's not sufficient, right?
Hmm.
Listening to my heartbeat would give you a message, but the EKG would give you a more comprehensive message. In this modern times, there are portable EKG or ECG machines. In fact, I remember making one available to a particular doctor, and almost 15 years later, he said, Stan, I still have that machine you sold me, and I use it. The client comes in, I hear irregular song. It's on my laptop, right? Because it's connected to the laptop and there's a printer. I take the diodes and I put it up there and I run a scan and I can get a reading, right? The point I'm making is that we have the infrastructure for primary health care. We have the doctors doing the visits, but I don't think we're going deep enough.
Okay.
Because just one.
Mhm.
If they suspect that something is not the way it should be, the next thing they do is send you
Somewhere
to
else.
general hospital,
Mhm.
right?
Mhm.
Now you have all these facilities around. Why send people to the general hospital? To reduce the traffic there, we have, for example, in St. John, there's a polyclinic that's underutilized. There are some
Mhm.
interventions that can be done there. I spend my last $5 to get to Guelph, and then you tell me I have to go to St. George's, and I have to spend the rest of the day waiting to see somebody, and then you give me a note I have to go to the lab. So people get fed up. I know people have gone to casualty and left. I had experience. I went there with one of my children, I think. And I'm sitting there because about maybe 1:30 in the morning, 2 o'clock. Nobody's there.
What?
And I'm sitting there 1 hour. So I called the number. General Hospital. I said, put me on to casualty. Yeah, you want to casualty. I said, I've been sitting here for 1 hour. There's nobody here. Nobody's attending to me. The answer was, yeah, I seen you on the
On the
I see,
monitor.
I see on the monitor. I said, but you're sitting here for an hour. And why are you not coming to see me? We'll come. Just wait. No, I'm talking about attitudes, eh?
Oh yeah, that's it. We have that club.
So we have that issue with
Mhm.
notwithstanding the infrastructure that we have, the attitude of healthcare providers often is from want. There's some fantastic people. When I was doing by the way, I should say that I have been involved with the initiative to bring national health insurance to Benin.
Okay.
Way back. I
Mhm.
think my first paper was written in 1998,
Mhm.
and it was captioned towards national health insurance in the year 2000. So that tells you how far back, right? With every consultancy that was done from then to now, I've been involved. So I have engagement with healthcare workers too. And I said to them, I said, you guys would not like to hear them say, but this thing would only work if your attitudes change. And they were not pleased. We were discussing remuneration. And I said, you go to a private clinic, right? And you give the client things that you give them top care. You just came from the government clinic, same doctor, but that client doesn't feel that you've done justice to him. Because in his mind, when he sits in your private clinic, you pay more attention to him. I said to him, I said to them, I said, that shouldn't be. I said, so under national health insurance, whether you attend to a client in your private clinic or in a public facility, it will be the same.
It should be the same.
So I said, the government who's paying you would pay you a particular salary. Then they said to me, but The reason why we are given the authority to do private clinics is because government cannot afford to pay us. Here comes my question. So can you please tell me what remuneration would be satisfactory to you? So if government is paying 6,000 now, right?
Mm-hmm.
Tell me that would make you feel comfortable. And none of them could tell me because there's no top limit for them. So you spend 9 to 12 in a public facility and 1 to 4 or 5 in your own clinic, right? All you have there, not even maybe a receptionist, not even a nurse to do triage, right? The same stethoscope, same blood pressure machine, maybe, same,
Tongue presser, stretch your tongue
yeah,
out and let it,
same
yeah.
things. Nothing. Some of them don't even have a cot to put you lie down, right? But they charge you top dollars.
Astronomical.
So my point is this: we have sufficient medical practitioners here. We have sufficient resources here that can elevate the care that's given to clients. And I don't want to call them patients, I'm calling them clients. What needs to happen is that policies need to be put in place to ensure that those guys or gals and or gals perform. One of the recommendations, and we're jumping all over the place, excuse me. One of the recommendations that was made is that with the proliferation of all these clinics, why do we have doctors renting a back room to see patients? Why can't we rent, in quotation, that facility to the doctor? So the government doctors operate from 9 to 12, and you occupy from 1 to 5 in the same facility. You come with your triage nurse, of course. You have the equipment there that you can use, and you pay the government a rent because we have sufficient facilities. In essence, what I'm saying is, and I told them that, I said, with the launch of a national health insurance program, standards would be set. You would not be um, accepted as as an approved provider. You don't have the minimum facilities in your office.
Okay.
And that is what they have issues with. I'm paying $700 rent, and I'm seeing 30, 40, 50 patients a day, and I don't have a triage nurse with me. Why you ask me to put all this additional money to pay people? And I'm saying it's a patient's care. For patients to get maximum care, they have to have the environment. They have to operate in an environment where they can get everything they want to get. So I've been rambling for a while. So I'll pause to
I
find out
mean,
if there are any specific questions you want to ask or Jester or
no,
interventions that,
we
that we
like
can.
to, yeah, we like to say good morning to our people because without them, we can't get anywhere. So let me say good morning to Cuz Derek Cyrus. Good morning. Thanks for checking in. Jenny Mason, thanks for checking in. Here's a comment. A complete blood test will give details of what the patient is complaining about. So many times, this is not, and the not is in uppercase, done. But instead, the patients are referred to other doctors. It is like sending the fool further on. And we see that all the time. Now, you made a point, Stan, about when you go to the doctor and they do the tongue press and say, so they could see the back of your throat to see if your tonsils and whatever is working properly, your blood pressure, the stethoscope for your heart thing. But I am one that firmly believe that if I go to a doctor and I explain what my symptoms are, and they just write a prescription for me, I would just ask, what are you giving me this for? And if I'm not satisfied, I personally will go for a second opinion. We as individuals and patients or clients, as you call us, has to know that one person that tells you something doesn't mean the be all and end all of what you are suffering from. Get a second opinion. It may cost you a few dollars more, but at least if they tell you the same thing that the first one tells you, then you feel a little more comfortable. You also spoke about people in Grenada that are just waiting to die. And that hit me really, really hard because I know of a few people that are suffering from kidney disease and they cannot afford $800 a session
Dialysis, yeah.
for dialysis, and they're just waiting to die because their body becomes septic, and die, and it's a horrible, horrible death. So, what can be done to abolish that or to make it a bit more easier for people?
Okay, on the issue of dialysis, it's expensive,
Very much so. I know.
and in Grenada, I don't know if they started doing it at the general hospital, but generally that's contracted out to a private provider that's doing this.
Mm-hmm.
Once this is done by a private provider, the cost would be astronomical, right? Again, we operating under a system where we do not have a national health insurance program. Everyone who has to get health care above primary to a certain level has to pay for it. I say all the time that if I go to a doctor and I pay in Grenada, it's because I want to pay. Because I can go to the clinic and get that same service free. It's available. So primary healthcare, seeing a GP, a physician in Grenada, is available. You may question the quality, right? But you don't have to spend the $150 if you don't want to spend it. That being said, though, is that there's some people who feel more comfortable going to a private doctor, even if it's the same person that's in the government, because the perception is he will pay more attention to them. Now, for the dialysis patients, it has to be a national intervention. When I say national, I mean from a governmental level.
Mm-hmm.
Because although I think in some cases they subsidize the cost, right? And then the Kidney Foundation also provides some subsidy. The amount of sessions that the average dialysis patient needs is usually informed by the funds that are available. Because if you're telling me my session is $800 and I need to do 4 per week, but I can only muster and I have to pay 4, it's 800 where I'm paying 4, but I could only manage $800 per week. It means I'll only do 2 sessions per week, right? So the ability to pay is what determines the care
What you get.
that the person gets. And that takes us to why this whole question about universal health insurance or national health insurance.
And that's
Because-
and
Yes,
Stan,
yes.
that's where I want to come in now, and because that is what is crucial, because it seems this is the direction in which we are heading, really and truly, with the intention of a new hospital coming on the scene. Healthcare, everybody should be considered. Now, you are part of the initiation based on what you say for national health insurance, right? What was strategic, or what is strategic during your time of the initiation, so that knowing that healthcare is it's costly, it doesn't matter what, so that it can become affordable to all.
Center yourself.
Am I centered?
No, you're not you, just when I say center
Just-
yourself, you know it's him.
Okay, all right. So I remember
Before you answer the question, we have a call coming in, so let us just take this call here, so you could save your
okay, no problem.
have we lost that call? Yes, let me just show it. Good morning. Hello. It seems that we have lost the call.
Okay.
The person will call back.
So
So let's move on. Yeah.
So national health insurance can only succeed if there is governmental buy-in. I went to the Bahamas when they launched national health insurance, and they launched it with the introduction of primary health care. We already had that, right? But that's what they started it with. Started it with. In Jamaica, they do not have primary health care at the level that we have. People have to pay. The way we walk into a clinic and get service and walk away, that's not available in Jamaica. So we had reached a stage. We have reached a stage in Grenada where we have already covered the primary health care aspect, and that's one of the reasons why I have some serious problems with some of the private health insurers here in Grenada, because they collected people's premiums. Those persons are going to public facilities, getting care, and they're not billed, right? Because it's free, right?
Okay.
But that's another topic. Come back to the question. So national health insurance or universal health insurance, as it's sometimes called, will only succeed if there is buy-in by not just government but top officials in that. And I know why I'm saying this. I was telling you I went to Bahamas and we met the Prime Minister of Bahamas, and he said, "I am personally involved because I want this thing to work." We went to
Okay.
Turks and Caicos, the same thing happened. We went to BVI. They were involved from the top, not handed down to somebody. We met the Minister of Health too, but he's following the lead of his Prime Minister. People don't know, but in my opinion, 95 to 96% of the work that's supposed to be done to get national health insurance launched in Grenada has already been done. Let me say it again. In my humble opinion, 95% of the work that needs to be done to launch national health insurance has already been done.
So what's stopping us?
I remember what I just said about the buy-in from the top.
Right.
Right. Now, one of the things that was raised when we was in Grenada and they did a comprehensive overview with recommendations, and the sticking point has been and is always one of how do the clients pay, right? I've emphasized and I keep saying over and over, and Jester mentioned it. Healthcare is not free. It has
It's
to be
not.
paid. Somebody has to pay for it.
Yep.
And if our administration, whether the past or the present, figures that the clients would say, well, another tax again or another, if that's your opinion, then we will never get to national health insurance. When we did the consultations, people who came said, I have no issue paying. And sometimes politicians think they know what people want, but they don't. They know what they want to give the people. Because I asked one person,
All right. Could we just 1 minute? Good morning and welcome to the program. Hello.
Person hang up.
yeah, that
What's
person,
going on? Or is the phone that is hanging up?
now we're not can.
What's
So
happening here?
yes, when the caller
Ah,
gets, we'll re-engage. So I asked the person, I said, do you have any problems paying for health insurance, national health insurance? I said, no. I said, but you saying you have a problem, but the government officials saying they have a problem in asking you to pay. Because in their opinion, that will be treated as a tax. I said, so what's wrong with tax? What is wrong? And I give the numbers. If you have to go to the diagnostic center in Grenada on the Carnage for a CT scan, about $1,200 to $1,500, right? $1,200 to $1,500 for a CT scan. If the average Grenadian has to pay, and I'm just throwing figures out, $50 or $60 a month, and you're getting secondary care, because I talked about primary care is what we offer. Secondary care is when you have to do certain interventions, diagnostics, etc. They won't mind. In fact, They spend more than that on lotto.
Mm-hmm.
Average, well, don't talk about the parties, right? But the solution, what was proposed is people have a problem, especially the salaried workers, those who we call established workers. It's easy to pull money from the salary because they are established.
Mm-hmm.
And we're saying that in order to make this equitable, you cannot let one set of people pay for everybody else, right?
Right.
So the guy who is begging on the side of the street or decide not to work, when he gets sick, you can't say you're in pain, so we're not treating you. National insurance has to treat everybody. So the proposal was that we introduce what is called a health levy. Similar to that, every purchase made for certain items, a portion of that money goes towards national health insurance. So if you don't want to work, you have to eat. You must spend. So your contributions will be tagged and placed. We have the environmental levy right now that goes to solid waste. Why you think the garbage trucks should go around and pick up garbage now?
Because we are paying for it.
Because we're paying for it, right? So a
Stand,
similar
hold a second. Just restart the phone for me, please, because someone is calling. The phone is not working. Just restart.
Yeah, that have been done already, but
Let me just try something and see. Go ahead, Stan. I'll try something.
yes. So the environmental levy is taking care of the collection of garbage. Before the government used to be doing that. Now they found a way to ensure that we, the people, pay for our garbage to be picked up, right?
Mm-hmm. Mm-hmm.
A similar thing has to be applied, in my opinion, to healthcare. We, the people, have to make a contribution. Governments would still have to do their bit. And in my opinion, if that is done, we'd be in a position to respond to the expanded care that's needed, right? So to answer the question Jester did not ask, the reason why national health insurance has not yet been launched, I could speak for the previous administration, is because it was conceived then that it would be a burden on the people to ask them to pay. And in my opinion, that was not correct, right? So the formula is still available. It can still work, and I think the average Ghanaian would not have a problem making a contribution. You see, because accessing healthcare should not be dependent on the ability to pay. Should not. And it is interesting that those persons who currently pay and they can afford it, their policies have limits. So they'll tell you your deductible is X amount and the maximum payout is X amount. Once you hit that level, you can't claim again. And people don't simply understand that. On a national insurance program, there's absolutely no limit, right? As
Mm-hmm.
long as you need care, you get care. Then we talk about the block hole. Well, I don't know if I'm using the right word. The road shows that we have almost every Saturday, asking for monies for people to get care, right? If it's not James who have leukemia, it's Mary Jane who have some heart disease, and the people are asked to make contributions, right? Now, I think it has been working because people continue to do it and people make contributions because it's somebody's health that's affected. So is that sustainable? What about those persons who do not have the resources to mobilize the roadshow to collect monies? What if the amount you collect is not sufficient to take care of the person's condition? What's going to happen? So, a more sustainable way of ensuring that the the care for people is taken care of is to work towards a national health insurance program. It's achievable. Um, all that's needed is the willpower. Now, I heard Jester mention about the new hospital. I must make it very clear. I have no problem with the move towards a new hospital. It's something good. But should that be a priority right now? Is it a program that we can sustain right now? Is it the answer to our healthcare problem right now? And how is it that you're saying to us that one of the ways you want to pay for this new hospital is to do national health insurance? What comes first, the chicken or the egg? You can't build a hospital and then launch national health insurance. National insurance should be in place. You should be collecting resources so that the time your hospital is launched, you know where the money is coming from. In BVI, Turks and Caicos, they have new hospitals, relatively new hospitals, that's funded by national health insurance. So,
Okay.
so
Let me ask
I,
you. Go
sure.
ahead. Go ahead. Go ahead.
So I know the initiative of the new hospital is going to positively affect our healthcare, but it should not be given as a solution, not in the short term. In the long term, yes. Short to medium term, no. What we need is improvement of local services. We need resources to ensure that we can expand the care that we're giving right now, right? So by the time we reach to the multi-million-dollar hospital, we have advanced care and there is money in the coffers to pick it up. Because listen, people go and spend 2 weeks in a general hospital, including foreigners, and tells the person who helped them take their bag out, thank you. Not one dry dollar is paid. Everything is free in Grenada. When you go to this hospital, you do not pay. And
Stand
foreigners,
hold a second. Stand, just so the phone is ringing. Are you hearing it? Because people are trying to call in and it's not going.
Yeah, Claire, just do that causing them just not coming through. I don't know why.
But it's ringing right now. Pull the plug from the top of the phone and plug it back in and see. Stan, and you know about phones? Those do it. Oh, Stan, you're not there.
I can't do it for me.
I know. I'm trying.
Yeah, yeah. So I think it's priority, and the gesture is right, but I think the timing is wrong. Um, the energy should be placed in getting national insurance off the ground. And for 4 years, again, I'm not being political. We had an opportunity to at least move some steps. When I hear the Minister of Health saying that they're re-engaging UWE, we paid UWE over $200,000 to do the study. The documents are there. If you bring them back in, they'll just tell you this in they told you 7 years ago. Why bring them back? We are supposed to move from um, recommendations to implementation. That's another story. But I sometimes sound harsh when it comes to national health insurance, and it's because I've been there. I know what's available. I know what can happen. I remember saying, look, a simple thing as registration, you can begin that. You can begin with registration. It's simple. But in the meantime, the average Grenadian is complaining about substandard care, um, shortages. I don't know whether that's true or not, and attitude problems, right? And the people who can afford, what they're forgetting is that their first stop is here. If a millionaire gets sick at 2 in the morning before an air ambulance reaches here, the air ambulance might get to Grenada by 2 in the afternoon, right? What happens to him between 2 a.m. and 2 p.m.? He has to utilize the services of the local um, healthcare facilities. That's what he has to access. So even though you have the money, you live in an environment, there's no guarantee that you will get care in an opportune time. So it's in the interest of those of us who have and those of us who do not have to ensure
Will
that we
will never
restore.
have.
Exactly. But not only that, they said clear, their health plan has limits. Even though they don't have a health plan, they have money. I know I read an incident of a guy who was a multimillionaire, and he said he got sick and he almost became a pauper because healthcare is not cheap.
No, it's not by not any means at all.
And you're spending money and it goes away. There's no returns on healthcare in terms of dividends, like if you're investing. You're spending money and it's gone. So having monies is no guarantee that
That's
you'll
going to
get
be
full,
well.
right? What we need is a robust, responsive, reliable system. Of course, affordability is key, but that is very, very critical to ensure that our people um, get care. So we have people with limited resources, right? There's limited healthcare resources and people with no money, a little money, right? We have to find a way to accommodate both sides.
Okay.
Government has to be from their side, and Grenadians, I'm sure, would have no issue making a contribution. Clear your paying for your service, right?
Yes, I am. Up
Exactly.
to my Ontario health insurance plan.
Exactly, you're paying.
Yeah, I'm paying.
Nowhere in the world, and
Nothing
I
is
say that all the
free.
time.
Nothing is free.
That is free. So,
So,
so
so here are a couple questions for you, Stan. On the onset, we spoke about, you said my last statement should be first that people are supposed to take care of themselves, right? So I'm going to bring out a few points and then tell me. Eating a healthy diet, exercise regularly, quit smoking, limit alcohol consumption, maintain a healthy weight, get annual checkups, manage stress, drive safely. People might wonder why so how that is coming, but we'll talk about it. Stay up to date on vaccinations. That is a big no-no for a lot of people, but we'll talk about it. Shop around for insurance, maintain good hygiene, ask for generic medications, contact telehealth, buy medication from a trusted online pharmacy, buy supplemental health insurance. All of the above. Are they going to play a big part in helping us with our limited resources?
it will play a part. You see, it is healthcare, though important, is not generally on the top of our agenda, right? And because we push it so far down our agenda, we don't bother. And I made the point about your dentist who calls you to come and do a cleaning because you did it 6 months ago. No, in your mind it might be well because he wants the money. But if you have a health system that tracks, people will be reminded
Hello, let me just try and see if we could take that call here. Good morning.
Good morning. It is me that is trying to see if the phone is working.
it's working. And we're hearing you.
And it is working
And it
now.
is working now. Right. Okay. So
Okay,
the call
so
is- so
Mr. Slag, make your call, please. Thank you.
Thank you. Yes.
Yes.
So if we have an established regime, every individual has to have the card. I'm calling it a card, where you know when is your next appointment, right? And you will be called and reminded that you have an appointment that day, right? Now, the importance of that is because, okay, so in the UK, for example, there are people who have appointments backed up to sometimes a year, especially for specialist care, right? Appointments ensure that you're in the queue, right? So with an established system, you are reminded, you get a call, right? That your checkup is on the 25th. We're just making sure that you are aware. So those of us who push healthcare to number 5 on the list would get a thing look. Somebody will call us.
But do they really push it back because they want to, or because they have limited resources to follow to go to get at their appointment?
So let me ask you this question. Okay?
Yes.
I'm not feeling too well, but I can go and buy a ticket to go to a show, right? Is it that what can I afford?
You could
I
afford
have
the ticket.
I have the money. It's about the same cost of going to see a doctor, but I choose to buy the ticket to go to a show, right? So what I've done, I've put healthcare down the line. Right? No, there's some people who generally cannot afford it. Those I can excuse. But those who substitute um, non-essentials to essential for essential, that's on them. No, the unfortunate thing is that at the end of the day, we
Hello,
all
good
people.
morning.
Hello, good morning.
All right,
Good morning.
Mr. Snagler, Stan Philip. All right, let's just take a pause here to accommodate a caller. Good morning and welcome to the program, caller.
Good morning. How are you?
I'm good.
All right. I'm hearing something else on the phone. I'm not sure where that's coming from.
Okay, hold on. Let me just check here. This is something. All right, is that any better?
Yes, it is. Thank you.
Right, good. Sorry.
Good morning, CJ.
Good morning.
Mr. Philip.
Good morning. Good morning. Yes.
Is it your guest name is Mr. Philip?
Yes,
Yes,
it's
I'm
Stan Philip.
Right. And clear. And Mr. Philip is expounding some information there that music to my ears, but it's typical. He sounds like he's a curator in the mind and nobody's paying attention because he's speaking some things that speaks directly to me. I agree with him. The primary healthcare system is pretty much covered in Grenada. It's doing a very good job. However, once we get past that, it seems to fall apart. I can speak from my own experience, but coming back to the subject at hand, I would say that trying to manage healthcare in Grenada with limited resources is very, very, very difficult. I am fortunate enough to be blessed that I don't exactly live in that situation. However, I have close family and friends and relatives and people that I know who are in that situation with limited resources. And for me, personally, I cringe to think of the sacrifices they have to make in choosing to allocate the resources for healthcare when the others are pressing so hard on them to the point where they can't even breathe. So for me, understanding the healthcare in Grenada, it's very difficult for me to understand how these people are doing it, given the situation that they find themselves in and having to make difficult choices. Mr. Phillips said there's people who are, as unfortunately, and they're literally waiting to die because they cannot afford to pay for the treatment or even to access the treatment. For me, that seems very disheartening to the point where I don't even know how to even express that. Yeah. But get to my substantial point is this. If healthcare in Grenada needs to change, we need to do some drastic things differently to ensure that the changes take in effect. Hello?
Yeah, we hear. Go ahead.
Yeah.
Right. So if as we do launch the national healthcare as the previous government, the current government, everybody's speaking about it, and people are concerned that they would have to pay. I am proposing that it has to come from the general public and, to me, tax the things that are causing the health problems to be exacerbated. 1, alcohol. 2, cigarettes. 3, excessive sugars. Okay? And reduce the cost on the foods that we need to purchase and also make us in a better state. The monies that come directly, I'm not talking a big chunk, 1%, 1.5%, and every bottle of beer that's sold, every alcohol drink that is served, whether in a restaurant, wherever, and we use that money towards taking care of the people that have the effects of the problem now, right? To me, there's the fund, there's all the money you would need to order to pay for the healthcare that you need to provide to your citizens. That's one. Two, Mr. Pierre, maybe I got the name wrong. Things talk about the attitude when you access or try to access the government-run system. The attitude there is absolutely amazingly atrocious. Yeah, you do have some bright shining stars in it also. I would say that I've experienced both. And to me, the bright shining stars outshine those negative attitude that you come across. But however, when you come across it, you are in such a vulnerable state that it sticks with you. It sticks with you and it leaves you looking at the whole system from that lens.
Yeah.
And that is not good. Yeah? No, we need to find a way to illuminate those stars that produce the results that we're looking for in the public and let the public know that there is good in it. And if the bad apples, you cannot do anything about it, to me, it is worth it to pay them the gratuity and send them home and tell them thank you very much for your service. That's my opinion on that. And I stand by it. Yeah, get rid of them and put somebody in there that who can produce the service with a shining star that everyone deserves, not just your friends or somebody you know, or is Mr. So-and-so and he has a title. That should not be involved in healthcare. Healthcare should be flat across the board for everyone. That's the ideal. However, we know in real life that does not exist. Oh, the third point I would like to make is that we as an individuals need to make choices for ourselves. If you know that you're susceptible to hypertension or high blood pressure or pressure as we call it, if you know you are diabetic or susceptible to be diabetic or sugar as we call it, you need to start doing things to take back control of your health. You need to exercise. I'm not talking going to the gym and pushing 100 pounds or 200 pounds and all of that stuff. I'm talking simply getting off the chair, getting out of bed and going for a 10 or 15-minute walk. Simple as that. Drinking more water. Put down the juice, put down the beer, put down the alcohol, put down the cigarettes and walk. Simply walk. Take a bottle of water with you and sip as you walk. Simple things we can do. Now, a lot of Grenadians are no longer doing the manual, strenuous labor work we are used to. A lot of us are sitting on a rump all day. And that's one of the worst things we could be doing to our bodies. Our body is not designed to sit. It is not designed to sit. We have to be able to move, stand and move around. You go to an office, you sit behind a computer screen all day, 8, 10 hours, and you don't move. The only movement you do, you might get up and go to the bathroom, or you might get up and go and get lunch. Other than that, you're not moving. Yeah, that is very bad for you as a human being just sitting all day long. You need to have some movements to you, and all of that takes into consideration of your good health. Yeah, so I would push back and say to you, we need to start taking responsibility for our health. One more point. When you go and visit your doctor or your primary care, some of them, not all, some of them behave like you cannot question them. You cannot ask a question. You cannot object to what they're recommended.
Yep.
It's like, this is what I said, I'm the doctor. And the response that I get sometimes, where did you go to medical school? That to me is so insulting that I literally got up from the doctor's office and walked out. And I say, send me the bill. I will pay it still, but I am not sitting in your office for you to talk to me as I am piece of feces. Don't talk to me like that.
Yeah.
I'm with you. I'm with you there. Are you there?
Hello? Oh,
The internet dropped, I think.
Seems as if we get cut off.
Yeah, he'll call back. But you see the points that he's making, Jester, the points that he made. It is bang on.
Oh,
Bang,
yeah.
bang. And the thing what Stan talks about is that, healthcare is something that, regardless of who we are, the amount of money we have, and I always say, money does not make you not dead. It does not make you not dead at all. Because there are people, I always refer to that man, what do you call him? Jordan, Prince Hussein of Prince Jordan of Prince Hussein of Jordan. These people have more money than money. He had cancer. With all the money he had in the world, it couldn't save him. Because, as we say, healthcare and the lack of healthcare in a lot of our countries does not work for us.
Let
I
the
think
caller,
of
the
back. Go
caller
ahead.
might be back. Oh, he's back. Yes.
Sorry, I'm not sure what happened there, but
Yes.
the call just dropped off.
Yeah.
So I forgot where I left off.
You left
So
off where you
yes,
you left the doctor's office. You ask him to send the bill. You're going to pay it, and you go about your business.
Yeah. That's where you left off.
He's not hearing me. You
okay.
tell him.
So
Yeah.
I didn't hear what Claire said. Could you repeat it, Jester?
Yes, what she said was that you stopped off at the point where you told the doctor
Send you
because
the
you asked him a
invoice.
question and to me it was a bit absurd or very insulting, even like you feeling that you can't ask him a question. So you said you left and they tell you you're going to pay the bill. So that was the point where you are.
Right. Okay. So yes. So for me, that is paramount. So if I don't understand what you're saying to me, and I ask you a question, you should be able to explain it to me in a non-medical jargon language, so
Yeah.
I can understand what you're saying to me. And when I leave your office, I should have a full understanding of what the issues are, what the treatment progress, and what to expect. Yeah. And to me, that is paramount. Most of the time, most people, I talk to people after they visit, well, what did the doctor say? He said this, he said that. I said, did you ask him what that means? And they would look at me like, no. And I said, well, why not? Well, I can't question the doctor. I mean, why not? You paying him for a service, whether you went to the clinic and it's so-called free, all the things you bought in the store that you paid VAT on, that's government money. That's your money. Yeah. So you did pay for the service. Indirectly, yes, you did. So you did not get it free. And he should be able to explain things to you in a rational and a concise manner. So when you leave there, you have a clear understanding of what your issues are and what's the plan to get you back to the best health that you can have. Right? And that's the fundamental difference I see here in the way medical diagnosis is made and done. It's a consultative things with the patient. The patient is an active participant in this. I am not a bystander. I am not a lab rat that you can joke and forward and do whatever you want whenever you want. No, I'm a human being. I can think, I can process, and I can. If I do not understand it, you should have the capacity to talk to me in a manner that will make me understand.
Yes,
yeah,
I agree.
But back to managing your healthcare with limited resources, trust me, that's a big task in Grenada. Yeah, big task in the Caribbean, period. And for me personally, I believe that Grenada, given that we have one of the premier medical learning institution in the world, I'm not just talking in the Caribbean, in the world, on our island, we should have number one healthcare in the world, period. Given our population size, that's where we should be. And I will not accept anything less than that. Because, like I said, if we're educating doctors as leaving Grenada and they're leading expert in their fields, why can we not have proper medical services on the island for us to be able to have a level of healthcare that sees the whole nation in a different way? Why are we still scrambling for every day to day, to have these type of things happening for us? That is to me, like I said, it's unanswerable. I cannot even think about why that's not happening. I've taken up most of your time here, people. Thank you so much for hearing me and listening me out. And I'm attention to hear how the next 25, 30 minutes goes in the guidance of your program.
Yeah,
You guys
Thank you
have a
so very much.
fantastic day.
Thank you. Thank you.
but your time was very much worthwhile. We made some very, very valuable points, and I just want to thank you so very much for your contribution.
Stan, Stan,
yeah,
let me
I
ask
want-
you a question.
Great afternoon.
Stan, let me ask you a question.
I'm not hearing what Claire's saying.
Okay.
Claire, who you want to ask the question? Stan or
Stan,
Mr.
Stan.
Okay. So we're done with Mr. Stark. He can go freely now.
And you can call back.
All right.
Thank you.
Thank you.
Stan, here's
Yeah.
a question for you. You have Holland or the Netherlands or the Dutch colony. You have Sweden. You have Switzerland. You have Amsterdam. These 4 countries that I know for a fact, the people are looked after like no tomorrow. They have free healthcare, they have free education, they have free for free. Tell me what they are doing that we in Grenada that have primary healthcare not doing. You tell me.
Okay, so I'll answer you that way. The country that boasts to be the strongest economy in the world have the worst healthcare system.
Bingo. I know.
Right?
Yeah.
And it's because in their mind, healthcare is about making money. Right?
I'm not looking after the people.
So in the United States, that is an avenue for raising funds. So there'll be a lot of pushback. They have attempted national health insurance in the United States, but Bernie Sanders would not listen to him because you're coming up against big pocket people, pharmacists, etc., etc.
Right.
Now, those countries you're called, interestingly, they practice what those of us who study political education calls democratic socialism,
Okay.
where they marry the capitalist system with some aspects of the socialist system,
Right.
where the people has to take first place in terms of services. So they have fashioned the economy in such a way where resources are channeled towards looking after the people. That's why they can give those services in quotation for free. It's not really free. People are
I know.
paying.
We say we get free healthcare here. It's
That
not
is-
free. We
that-
pay.
that is why. But as long as we look at this thing as a profit-making business,
It
we'll have
won't work.
issues, right? We'll have issues. So that's my answer. But I want to respond to 2 things that the caller said. When he spoke on the issue of attitude, we have not too far from us countries that have solved that problem. Eh? In the BVI and in Turks and Caicos, there are 2 hospitals are statutorized. It's not run by government. It's not run by government.
Okay.
Now, an attempt was made in the past to statutarize a hospital many, many years ago. Certain trade unions and trade unionists pushed back against it because in their mind, job security was questionable. Because when you're in the public service in Grenada, it's a service where you can do anything, say anything, work when you want, how you want, and your job is secure.
Gotcha.
Right? The attitude of these healthcare workers is the way it is because they're working for government. When the BVI decided to, Turks and Caicos decided to statutorize, and asked that question of the director, how did you manage? Your hospital was run by the state, and it's now run by, I think it's Health Canada, one of those countries, one of those companies. He said, well, the workers were given a choice. You're not going to work for a statutory corporation. We are the ones who will be paying your salary. But if you want to stay with government, you can stay with government. They would absorb you into the health system. Whatever job you get, you take. There was some reluctance. That's what he told me. But eventually they came around. The attitude changed because they were no longer government employees. They are now employees of an organization.
Right. Mm-hmm.
And that is one of the solutions to correct the attitude. Now, I know we have the process going on in Grenada, right? Um,
Mm-hmm.
the end goal is noble. As to whether I agree with every step that's being taken is another matter.
Okay.
But I maintain that the one of the best ways to ensure that attitude of healthcare workers change is to ensure they're no longer employed by the government of Grenada.
Okay.
So that's one. Secondly, talk about about the hospital, the alcohol
Polytechnic.
beverage.
Oh,
Under the model proposed, I spoke to um, the health levy.
mm-hmm.
Also in that model, another avenue that was identified for providing revenue for managing the national health insurance was what we call syntax. That's literally how it's called, syntax. So all the things that the caller mentioned, alcohol, tobacco, sugar, all of those things would have been incorporated. Unfortunately for us, we have already placed levy on sugar. And that goes
Mm-hmm.
into the government conference as to whether they want to redirect that is another matter. Another avenue we identified was lotto. So instead of saying sports culture and nation building, we'll say sports, culture, health. A percentage of this lotto money can
Go
be
straight to
allocated
health.
to national health insurance,
Mm-hmm. Mm-hmm.
right? So there are low hanging fruits that can be reached as far as revenue for healthcare. In some countries, visitors pay a fee that goes towards health when they enter the country. So
Mm-hmm.
there are ways that we can find um, to pull from to fund national health insurance. So we're not short on possibilities. But
When you say syntax, is it SINTX
S
like the
S
comic
I
sin, or
sin
SYN?
do sin SIN
Oh, so that is
because
the bad tax.
the bad tax, right? So
Okay.
things that like alcohol and it's called syntax because those of us who are Christians see
You're committing
using those
sin when you're drinking
substances.
all that. Mm.
All right.
Abuse. I
So
got you.
so it's a syntax, right?
Okay.
So to me, the crux of the matter is the will, the will of the powers that be to ensure that we have national health insurance.
So
That's
let me ask you
critical.
something. Then the will of the powers that be.
Mm.
So let's say the people of Grenada or people of wherever country that are suffering from health care because of the limited resources or the amount of money that they have. If the people sign petitions to say, okay, this is what it is, that everybody comes together on board with it, you think that is going to push the government to say, well, the people are really speaking out there because they want this and they will act on it?
So the people have not signed petitions, but they have spoken. But the problem I have with our government is that they see as far as the next election is concerned, the votes.
Mm, mm,
So if your reason for not doing national health insurance is because you have to charge and people would see it as a tax,
mm.
right? If that's your reason, you'll never have it. Now, somebody asked me the other day, why is it that for the past 4 years nothing happened on national health insurance? And to answer them, I had to get personal. So I said to them, as the Minister of Health, right?
Mm-hmm.
And I was tempted to say something, but I'm not going to say it.
No, don't say it.
The bottom line is that when we see in a small country, when we see people's political alignment before we see national development, we always have problems. And it happens all over, right? It happens all over. The interesting thing is clear. And again, I don't want people to take it wrong. The only times I've not been involved with national insurance is when the National Democratic Congress is in office.
Okay.
That's the only time I'm not involved, right? No, I don't know how to interpret that, right? But as one, and not boasting here, is a fact. One of the persons who have been endowed with the most knowledge as far as national health insurance is concerned I can't understand why all the talk that's happened around national insurance, not once I've ever been approached. I have reached out to the Ministry of Health. In fact, I was involved, and I'm going to say what I didn't want to say. I was
Well,
involved up to June 2022.
Okay.
And then I was told my services are no longer needed. Not
Okay.
because I don't have the knowledge, but because I'm probably singing the wrong song. Anyway, so but I think in the interest of the country, we can only improve our healthcare situation if a system is in place to ensure that those who cannot afford are able to access the care, right? Those who have limited dollars are not restricted. We have to stop or minimize the road shows, right? To collect monies to I mean, come on. Every time I hear these things, I give when I'm close to the truck, but I say to myself, that's one out of maybe 20 persons who need the care. That guy knows somebody could organize your road show, so you organize it. That's one out of 20. The other 19 persons are there suffering silently.
And waiting to
We
die.
have to have a more organized, structured way. In Grenada, we are not in a position to offer full secondary care, and we cannot offer tertiary care.
Okay.
What was promoted when I was involved was that let's find a country that can facilitate this. What is happening now with the United States that used to be the country people go to for healthcare? You know, that is apart from people talking about vacation, right? So people cannot get visas to go for vacation. Not only
Right.
that, anything you need visas to go to the United States to do,
You cannot
would
get
need.
it.
So
Yeah.
what do people who need care in the United States do? But there are alternative markets, and I think Grenadians should know. United States is not the only place you can go.
No?
UK is not the only place you can go. I visited Colombia on 4 occasions. Colombia has one of the best organized healthcare responsive system in this part of the world. The best I'm talking about, Claire. I visited 14 top-notch hospitals. You know what's the difference between their hospitals and the ones those in the United States? You know why they can charge less for better care? Because
No.
they're owned by foundations,
Okay.
not privately owned. Right? Anytime healthcare is about profit, we have issues. So the model was you do primary, some level of secondary in Grenada, and you need overseas care. An air ambulance, if you need it, would fly from Colombia, come to pick you up, or you're sent to an hospital. I met people from other Caribbean islands in Colombia accessing care. I met Americans accessing care, and you would be surprised to see the cost. And one of the concerns I have is that we are pitching our Polaris to pull clients from the Caribbean. But if we're not competitive in terms of cost, we won't make it. Because I'm
Okay.
telling you, Claire, I showed one of my friends that it was cheaper for him to go to Colombia to do an operation than to go to Trinidad. And I
Yeah,
showed him
Trinidad is expensive. Yeah.
showed him the numbers. And
Yeah.
because it's all because of the structure of the organization. If your structure is based on profits, then you will be expensive. If it's based on care, then it will be affordable.
Stan,
So-
there was a time when all doctors, as far as I hear, signed an oath that the patients should be their first priority. And that's for providing care for them. As you say now, it has become a money-making thing that you don't have money, you don't get care. And I think hence the reason why people pass around in motorcade or chococade or watokawocade or whatever to help someone that is sick and looking for care, because it is not, I'm not sure if it's not available home, or the amount that you have to pay for it, and you can't, you may end up dead, as you say. A lot of us, I'm putting myself in a waiting debt because we cannot afford it. Even to travel to Trinidad or Barbados or wherever it is that you decide to travel, you cannot just go with your plane fare. You got to go with the monies that they're going to charge you for to look after you. So healthcare is not cheap. We all know that, but it could be manageable and affordable if everybody has a change of heart to say that this is a person and that person needs help or that person needs care, and do that for them.
Right.
I'll give you an example. Carnival Tuesday. It is supposed to be a working day in Grenada, Carnival Tuesday. Yes or no?
No.
Support, well, unless declared otherwise.
Is it
Because
supposed to be a holiday?
in the past, there had to be a declaration for it to be a holiday.
Yeah, I know it wasn't a holiday.
But no, it's kind of automatic.
Oh,
That it's
because I
a,
remember Monday was a holiday and Tuesday was half day or something like that. That's
yeah,
when I know.
used to be
Okay.
in the past.
So
That
now
changed.
there was someone that got sick on, well, their person was sick and was getting worse by the moment, and her daughter called the facility where they asked her to call. Somebody gave her a number and said, call this facility, and ask for this doctor. With the same attitude as you're talking about. What wrong with you? Today's carnival, you don't know doctor around the place. I mean, when you call certain places and get those answers, that doesn't give you the gumption to look to them further, because not everybody has that attitude, and we have to explain that. Not everyone. But when you get it from someone that you expect to be okay with you, it
Yeah.
just changes
Yeah,
everything.
it changed everything.
I remember years ago that I came to Grenada. At that time I wasn't, Grenadian yet, per se, as they say. And I went to the ministry, the revenue office or wherever, to get some stuff done. And I met one of the guys standing by the door, and I said to him, I'm here to do this. And he said to me, you got to come back after after Christmas. And I'm like, why do I have to come back after Christmas? And the office said, oh, you have to know that around Christmas and Carnival, nothing takes place in our office.
It takes place.
And that freaked me out. Right, I'll never forget that, because I'm saying, if you are working and you're serving the public and you're a public servant, and you're home for just 2 weeks and you need to get that done, and they tell you to come back after Christmas or after Carnival, what does that say?
Yeah.
So we really we have an attitude club, and it's not easy to get into it because it's failed.
Yeah.
The bad attitude club, it is failed, because so many of us have that bad attitude. Even places where you go to buy food, you get attitude. You go to the police station, you get attitude. You go to this place, and those that are giving you the bad attitude are the minority of the whole place.
Yeah.
And that spells something bad on the whole system.
Yep. No,
So-
like I said, the attitude stems from who they answer to, because you compare the service you get in the private sector with the service you get in the public sector. There generally is a difference, although the private sector is starting to almost behave as a public sector. But
Yes.
I think if people need to take pride in the work they do, right? Some medical providers, the medical training and the attitude towards patients comes first. Others, depends on who
money.
it is. Right?
It's the
If
money.
a friend of mine come, I'll give him top care. Another person comes.
Stan, Mike, go ahead, finish, and I have a question for you, Stan.
No, that's you can go ahead.
Right. We are seeing that in recent years, we are seeing a sort of brain drain. We're seeing some of our most qualified nurses and doctors are leaving our shows to go to, as they say, greener pastures. What do you think can be done to, because nowadays we need our medical practitioners, really and truly, because healthcare nowadays has become a wider thing to look after. what do you think can be done to keep our medical practitioners here? Because we spend so much of our state-owned resources to develop our nurses, right? So in the case of our doctors, sometimes we send them on scholarships, and we don't get that much benefit of their prime working life with us. And I am very much concerned about that. So, what say you when it
When
comes to that?
when I came back from studies, I had a 4-year bond signed. Right? I had to serve for 4 years. I didn't make the 4 years, but I was released. Um, Nowadays, the there are people who get into profession for the money, and some people get into profession for the love of the profession. For the people who have been trained for free, money should never be their driver, right? Because the state extended resources for them. I have a niece who is a medical doctor. She studied in China. She came back to Grenada and she got a contract for 1 year. She had to walk after the people for the second contract. She got one for another year. And they did not give her a contract for the third year. So she went to SGU to work, medical doctor. So to answer your question, Jester, the individual has to determine whether the profession is more important than the money, right? If the system of bonding is in place, that's what you sign before you go. And you sign saying that on completion, I have 3, 4, 5 years to serve. Hold them to that. If they are held to that, they will not go, right? If they are held to that, because it means when you add up the maybe close to $700,000 that it costs them to go to SQ, and they know they have to pay it back, they'll be reluctant to go. Right?
Gotcha.
So where there's a loose system, people take advantage of it. So what should happen is that the system should be tightened. Right? That's the persons who get scholarship. Now somebody who pays their own way, we can't tie them. If they want to go, they go. Right? But I think the people should be reminded about why they have embarked upon a profession. And if the intention is to serve your country, um, then you serve your country. Because when I was released from my bond 9 months after my 4 years, I could have decided to travel to go and work somewhere else. I never did. I stayed here, right? So the individual has a lot to do with it. But in short, if the system, especially for those that's funded by the government of Grenada, whether through scholarships or not, once they're held to the bond, that's okay. But Trump has helped us to solve the problem, because he is saying that if you are a medical doctor, a medical professional, and you want to come and work in the States, you have to pay. Right? So it's finding those who want to go and work over there. So maybe that would help to solve the problem. He's not even giving visas to those who want to go and do their internship in the States. Can't go there anymore. And I understand that the UK is moving in that direction also. So the the global environment is closing in. That's what will help to solve the problem. But yes, we have a situation where many of our doctors, right, they go to do their internship, they get a job and they remain, right? They qualify, and some of them sometimes come to give a week or 2 weeks. But it's strengthening the system where those who are bonded are held to the bond. And I can guarantee you that drain will be extended.
All right. So let me just come in here, Claire, because and let me tell you all handle like this at this point. Now it's now 12 o'clock. Certainly, we did not get as much as half of this program. All right. There are some dates lined up in September because we will have to bring standbacks. We have as from next week, we have the first we have the 8th, we have the 15th, we have the 22nd, we have the 29th.
Or the whole of September, just so we have all of September.
Right. So, well, we could say that too. No, but we're trying to fix a date one time. For
Yes,
Stan,
okay.
I
Stan is flexible. You can come anytime.
Yeah, I'm flexible.
Okay, but we really don't want it to stay too long. I believe we need to get back. If not next week, the following week, I would prefer. You know.
Well, Stan, how is
No.
next week for you? Because we hot on it right now. Let's kill it.
Yeah, we can do next week.
Right.
So are we saying that we'll come back for a part 2 on the 1st next week,
Yes.
Tuesday,
No
God's will?
All right.
Yeah,
Sure.
sure.
All right. So
Yes,
I
because
think
we
that,
haven't touched. Yeah.
no, yeah, we haven't. We just scratched the surface, really. I realized. So,
Okay, no problem.
all right, ladies and gentlemen.
Oh, Stan, no, hold Stan. I have a message. Stan, somebody says Stan, tell Stan NDC will never embrace him with his whatever you have that you go to study and everything like that with your expertise
Oh,
on what you do.
it's not about individual. I mean, I think it's about
Country.
and if country is first, then it shouldn't matter because
We cannot be thinking about this NDC and NP thing, because really and truly that what you tell me about all that work that has already been put in for, you say, from since about 2000 regarding national health insurance. I really believe that we need to get this work put on and come to some kind of thing for the best interest of all of our nation. So this,
All our people, yeah.
That to me, what
Look,
matters.
let me say one thing.
At the end of June, I was told we were instructed to remove it from the payroll. Just like that. That's what I was told. And I understood. But like I said, we should not be in the interest of our country. We should not reduce this thing to support. I'm a Grenadian, right? And any Grenadian who wants to make a contribution should be given the opportunity. Because at the end of the day, I keep saying, my relative, my friend can fall sick. Your relative, your friend can fall sick. And a system that can step forward and assist them should be in place. And if we have an opportunity to ensure that we put it in place, we should put it in place. That's all I want.
Now here, there are people in the diaspora that are Grenadians that are listening to our program every Tuesday. And I'm happy that we're bringing this today and continuing it next week, because some of them want to migrate here, Stan. And not all of us want to every 6 months fly, jump on a plane and come to Canada, come to different parts of the world so that we can get our health checked. So if we are talking about this, they know what they have to look forward to coming to Grenada, and they also can make a contribution towards getting healthcare top notch in that little rock of ours.
Right.
Because once you get here and you have to go see a doctor, it's not every week you can fly to the US or fly to Canada to get it. And I'm saying this, my final point is, I live in Canada for 30-something years. I've been to the same doctor for the same 30-something years that I've been living here. He's coming to the age where he won't be able to look after me anymore. And I'm saying that whether you are conservative, liberal, NDP, Green Party or not, once you're a human being and you have what it takes to get to a doctor, the doctor would say, okay, you did not vote for the NDP, or did not vote for the conservative or the liberal, so I'm not looking after you. It shouldn't be about who you vote for or what party you're supporting. You are an individual and you're sick and you need to be looked after regardless of what, bar none. My final thought.
Yep.
Oh yes. Stan, before we close off here, any final word just before you depart?
Yeah, I must thank you guys for the opportunity to share. My passion is to ensure that I see in my lifetime a system put in place where Grenadians can live comfortably, can enjoy life comfortably, and should not be stressing themselves out if and when they get sick. And I'm hoping that we'll reach to the stage where we'll embrace that. All of us have a part to play. Let's make our contributions and let us give support to any initiative that's leading towards a system where all of us can be cared for when it is needed. As Claire hinted, whether you're from the diaspora or local, if you fall sick in the middle of the night, you have to access care in Grenada. So let's beef up what's here. Then we could think about traveling after stabilization. But you have to be stabilized here before you can fly out. So thanks for the opportunity. Look forward to joining you next week.
Thank you so
Stan,
very much.
Okay.
Stan, I want to take the opportunity to say thank you so very much for appearing on the Take 5 Mental Health Show program so that you can share within your expertise, enlighten Grenadians as to what is taking place when it comes to national health insurance. And as we say, we just scratch on the surface of the dirt. We haven't really started to dig as yet. And so we expect you back here to start really digging next week, Tuesday, God's will. So you have a wonderful day. Enjoy what is left of Tuesday. All right. I'm
And
looking
to
to
Okay.
see
all
you
those
on
who are on the live and checked in, thank you so very much. We do appreciate you checking in every Tuesday with us.
Okay then. Bye
Okay,
everybody.
bye-bye. Bye.
Bye. Bye.
Oh,
Oh, Claire, my dear. What a program it was indeed. What say you,
Yeah.
girl, just before we depart from each other?
Because you're looking gorgeous. Look at me. Huh.
Don't flatter yourself.
friends always there. But in your mind, peace.
Well, listeners and viewers, that's where we come to the end of the program. Of course, I would like to say thank you so very much on behalf of my co-host Claire as well.
Every Tuesday
As I say, it's not an easy thing to sacrifice your mid-morning hours to be here with us.
for you.
That we don't take for light.
Your breath, take your time. We're here to realign your mind.
For all those that made the contribution,
Take
whether it was calling in or
Lord,
making the comments on the line,
yeah.
thank you so very much for making the program what it was. For today, Tuesday being the 25th of August 2026.
Away mental health and
Of course, my name Jester Noel,
raise a toast to
and the lady on the other side.
the
I am CJ.
you've seen you're truly hurt. We got your back, you've got our word.
Of course, we are getting ready to
Take 5,
shut down for today.
talking truth and lifting pressure.
Every Tuesday, 10 to noon, we holding space just for you. Take a breath, take your time. We're here to realign your mind. Take 5, you're not alone. CJ and Jester bring you home.
We laugh,
Laugh, we cry, we share light with
children
nothing
here just
but
loving like you've got a place right here to stay. So take 5 and heal today.
So
Take 5 with CJ and Jester, talking truth and lifting pressure. Every Tuesday, 10 to noon, we're
we
holding
Once again,
holding
thanks
space.
to all who made it possible. Speaking of Dougal and the rest of the Real FM crew, how can I leave you out of this?
realign your mind.
Claire, sing, girl, sing.
It's not alone. CJ and Jester bring you home. Oh.
Sugars Repair Services, we offer
So, Claire,
Bye, everybody. Mwah. See you all next week. Love y'all.
we have come to the end of the road for today. All right, so I myself have a funeral to go to, girl. So much
Who
funeral.
dead?
Back funeral. There's a lady that is burying, they call Miss Velda.
Mm.
Yeah, from Latas. She spent many of her life living in America.
Okay.
She's been, she lived in Grenada in the latter part of her years, being in Grenada, she and her husband. And, but she died in the States, and the children bring down the body, so she's buried today.
Okay. All right.
Right. Tomorrow, please.
Whenever people passes, it's not an easy thing to deal with. So my condolences to everyone. So
Yeah.
yeah. Bye-bye. Bye.
Bye, girl. So you do on this end days for me to
No,
get
no,
on.
on the pod. I'm gonna do my do.
Okay.